So PSMA PET-CT is an imaging modality that we use for prostate cancer. We use it for staging in initial diagnosis, and we also use it to identify sites that we can treat with radiation for patients with metastatic prostate cancer. But for patients who present with metastatic prostate cancer and we start them on hormonal treatments, there's actually been very little study about what happens to PET scans on treatment and how those PET scans are then used for clinical decision making afterwards. So we did a project just looking in our own database to identify patients who had PSMA PET scans about 3 to 24 months after starting their hormonal treatments for metastatic prostate cancer. And we identified 68 patients who met those criteria. So we just looked at what the PET scan showed at that time point and subdivided them into three groups. We defined group one as patients where the cancer basically disappeared on the PET scan, that there was no residual evidence of disease. Group two was patients who had radiation after starting their androgen deprivation, and we still see some uptake of the tracer that we use for the PET scan on the PET scan. And then group three is defined as patients who had disease that was seen on the PET scan that was never radiated. And what we found was that the most common intervention after doing these PETs was actually stopping the hormonal treatment at some point in time. So 16 of the 19 patients in group one stopped their hormonal treatment. 12 of the 13 patients in group two stopped their hormonal treatment, but 18 patients in group three out of the 36 stopped their hormonal treatment, but 11 of them had some form of radiation to the sites of cancer that was seen on the PET scan before they interrupted treatment. And so we thought that this was a very interesting observation because people were using these PET scans to then decide on one, whether it makes sense to do some radiation to the sites of disease that were still seen on the PET, and two, if it was successful, that you could eventually interrupt treatment. And treatment interruption is of very much interest to us and the patient community because these hormonal drugs can have long-term side effects, such as muscle strength going down and bone strength going down, fatigue, hot flashes, increased risks of cardiovascular events. So we just thought that this PET scan could be a useful tool that can then be explored for its utility moving forward.